Hello, everyone. My name is Abdi Osman, and today I will be talking about personal and public health. First of all, I work with the Refugee Education Center, and my role is a volunteer coordinator currently. So to start with, I think when we are talking about personal and public health with our refugee students and families, I think it's really important to establish some sort of relationship with the families and the students and having to build a trust. So if you have those two things built in your communication, I think it's going to go really smooth and there's going to be a lot of understanding and lots of improvement and answers to the questions that you have and be able to convey your message very well. And the other thing that I'm going to discuss and recommend with your communication is I think it's really a good idea to use your translator. So if there's a translator in hand, or if you have any volunteers who share the same culture, the same religion and language with the person that you're communicating with, either the students or the families, I think that's the right person to go with. And the other thing is, I don't think as an assumption is really a good idea in communicating with the community. So don't really assume anything, especially right now in this pandemic. If you're talking about having to wear a mask when you're going outside into the public, avoiding in a congregation more than 10 people, or having to wash hands and not touching your face more often when coughing, making sure that they're coughing inside their elbows, and when taking students to the park, making sure that everything is sanitized before they use the equipment in the park. So all this, information is really good to share with the public. I mean, with your students and with the families through a translator. If you have a translator available, make sure you use that because translator, this is their job. Um, they're signed up to do and they getting paid for it. And of course, they have to follow procedures and protocols and all of that so that, whatever they do is confidential and it is perfectly trans, um, transferred from you to the students and parents. And one other thing um, is don't use a child to translate for you or their parents. That's totally not going to work. It might work sometimes, but it's not really recommended. I don't think it's really going to be a good idea for you to use a child to translate for their parents. And the other thing is if you feel like your communication is not reaching to the right people, make sure you reach out to local organizations, agencies. They can help you really well because they organizations work really well with communities and agencies, of course. That's the number two thing that you can do. And the number three is really important, which is the community leaders. So community leaders have really good communication with their communities because they're the community leaders and they've been respected and well trusted. So whatever they say is something that needs to be followed, something that needs to be done, or whatever matter or time is required. Especially right now, like I said, COVID-19 is really something that we need to be careful out there. So if you're communicating this type of information, make sure that you're just communicating well with the people that you think have a good build interesting relationship with their students and parents. Hopefully, this is going to be a helpful tip for you to um, share and to follow. And yeah, thank you.